I really love both sides of measuring the impact. The one thing I always knew I wanted to do was make an impact. I know it sounds so cliche, but that was just as I was searching for what I wanted to do, I didn't know if it was in law and social work and medicine and what have you. I just wanted to make a difference. I felt very hungry for that. And I loved those human stories. And so I loved understanding the impact on a human level that I could make and the impact that I was seeing other people make around me. And that those human stories were always very special to me. And then as I went along in my career and figured out what I wanted to do and started my master's, I got deeper into epidemiology and what that meant. And I loved it. I grew up with such an aversion to math and numbers and just didn't think that it was for me. And then when I started studying epidemiology through my master's, I started understanding that in addition to human stories, you could also have these data stories, and you can also tell stories through data.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Welcome to Public Health Careers. In today's episode, you'll hear more about 1. How wanting to make an impact led her into public health and then into the world of digital health and public health. 2. Learnings and advice around the intersection of public health and digital health for students and career professionals. And 3. Getting clear on your mission and your whys are important for your growth in your career as a public health professional or in any other professional career. Be sure to hit that subscribe button if you enjoyed today's episode and you want to stay up to date with this great content. Leave a 5-star review and share this with someone who gets some value from it, as that really helps the show get out to more people, as well as helps other people understand all the career paths that they can do in public health. Lastly, there's a link below to support the Public Health Millennial and Public Health Careers by either becoming a one-time contributor or a monthly contributor. So check that out if you're interested. I greatly appreciate you all, and be sure to share this with someone who gets some value from it. Enjoy.
Hi, this is Tali Segev. I'm a leader at the intersection of public health and digital health and the vice president of MyndYou, a digital health company that helps broaden access to care. And you're listening to Public Health Careers.
Today, we have a passionate advocate for combining data and human-centered care to advance health outcomes. She conferred a Bachelor's in International Studies, Global Health at the University of Illinois Urbana, Champaign, then got her Master of Public Health at the Hebrew University of Jerusalem. She currently works as VP of Customer Success of MyndYou. We have Tali Segev, MPH. Welcome to the show.
Thanks so much, Amari. I'm so happy to be here.
Yeah, I'm supposed to do this sharing thing, and I always forget. But yes, welcome to the show. I'm very happy to have you as well. Looking forward to hearing about the work in your public health and in digital health and that intersection, as well as your career story, because it's fascinating as we're talking a little bit about prior to starting recording. So before we get into all of that, how do you identify and how are you doing?
I'm doing great. And I identify as a woman with Jewish roots in Iraq and Eastern Europe. I'm really happy to be here. And like I told you before as well, I've been listening to your show, and just every person that you have on just has this amazing public health career story. And I wish this was around when I was trying to figure out what I wanted to do. So this is so great, and I'm extremely happy to be a part of it.
Well, that makes me very happy, and I'm glad that you are being able to contribute to the thing that you wish you had, because that's the same thing that I wish I had. So yes, this is all positives for everyone all around here. And then, like in that vein, talk more about metrics-driven and human-centered approaches to drive impact and positive change for healthcare consumers.
Absolutely. So I really love both sides of measuring the impact. The one thing I always knew I wanted to do was make an impact. I know it sounds so cliche, but that was just as I was searching for what I wanted to do, I didn't know if it was in law and social work and medicine and what have you. I just wanted to make a difference. I felt very hungry for that. And I loved those human stories. And so I loved understanding the impact on a human level that I could make, and the impact that I was seeing other people make around me. And that those human stories were always very special to me. And then as I went along in my career and figured out what I wanted to do, and started my master's, I got deeper into epidemiology and what that meant. And I loved it. I grew up with such an aversion to math and numbers, and just didn't think that it was for me. And then when I started studying epidemiology through my master's, I started understanding that in addition to human stories, you could also have these data stories, and you could also tell stories through data. And so that impact that I always wanted to make growing up, and the impact I hope I'm making today, my team is making today, we get to measure it both from the human stories and from the data stories. And it really, that's what gives us the full picture of what we're doing, and if we're in the right direction, if we're not in the right direction. And having those two types of stories complement each other is one of my favorite parts of what I do.
That is awesome. And I think like driving from like just wanting to make impact to seeing like there are different ways to make impact, to seeing that there's both the data and the human side of things that comes together to like give this holistic picture of what that impact is. So I appreciate you sharing that. And I want to ask more about public health and digital health, but I'll ask that when we get to MyndYou, because I feel like that it'll be more timely of a question then. So before we get into the beginning of your story in public health, I want to ask, what does public health mean to you?
I love that question, because I feel like public health, when I was getting my master's in public health, by the way, when I started getting my master's, every single person was like, what's public health? And then, fast forward a number of years, and we were in a global pandemic, and suddenly public health was every single headline that you would read. So it has also been really interesting for me to see the evolution of public health in the last 10, 15 years.
Right.
For me, public health is the systems in place to help people achieve quality of life and longevity. And it really is both of those things that have to come hand in hand, quality of life and longevity. And there's this phrase in Hebrew that people say to each other on their birthdays. Ad Mastrim is the phrase, and it means may you live until 120. And it's a blessing that when you greet someone on your birthday, you say, may you live until 120. And there's a common twist on that phrase that my friend's grandma taught me when I was growing up, that it's not may you live until 120, it's may you live until 100 as if you're 20. And that is what balances. You need the longevity, but you need the quality of life in order to really be a healthy person. And so that's what health is. And then if we take that to the public health level, what systems do we have in place to support both the quality of life and the longevity? Institutionally, community, family, individual. How do we support people on their journey to achieve health?
I love that. And could you repeat the phrase again? May you live until 120,
yes.
Or may you live until 100 like you're 20?
Yeah, do you want me to say it in Hebrew?
Yes, please, and thank you.
So in Hebrew, it's ad ma'asrim is the phrase. And my friend's grandma, whenever someone would say that, she would go, nuh-uh, not 120, 100 as if you're 20, which is ad ma'ke'esrim. So it's a very small difference, but shout out to Savta Dalia for helping form my view of public health from such a young age. So ad ma'ke'esrim.
Ad ma'ke'esrim. We'll practice. We'll practice. Thank you.
It.
Yeah, but that's really awesome. Like not only for these, they live until 120 perspective, and like that just being a thing that people naturally say on your birthday, but that shift in perspective, like live until 100 like you're 20, because I think like that is a lot what we're trying to achieve in public health. We're trying to get populations to live until 100 plus like they're 20, and I think many times we don't think about like what is that quality of life for people, and how do we get the best quality of life for people as they age. And that's beautiful, and I'm glad that you shared that with me today, because I never knew that was a thing. So that's beautiful in itself, so I appreciate that.
Thank
um
you.
you're welcome. So you got your Bachelor's of Arts in International Studies and Global Health at the University of Illinois Urbana at Champaign. Am I saying that Champaign part correct, firstly?
Yes, you are.
Okay. So what was that thought process going into your bachelor's program?
Wow. So that was actually a pretty intense thought process for me to get to that point, because I started my bachelor's at University of Illinois, U of I, and I really had no idea what I was doing there. I didn't know what I wanted to study. I didn't know if I even wanted to be there. I was coming off a few years of my mom had been sick with cancer. Thankfully, she recovered from that. And I went straight into living away from home, trying to figure out what I wanted to do. And it was an extremely hard first year for me, where I considered postponing it. I considered saying, you know what, I'm just going to put this academic life on pause. I'm going to figure this out a little bit more, and then, move home and see what happens. And then I kind of got a bit more involved on campus with different groups, different communities. I became more of an activist on campus in certain ways, in certain places, which I know we'll talk about, because that formed a lot of the work that I did during my bachelor's. And I got introduced to this program, this global studies program, which had it had so many unique tracks. So you could choose different regions, and then different focuses within those regions. And again, I wasn't sure which direction I wanted to go with the focus, but I ended up choosing this global health track, which was so interesting. It was a beautiful program that really combined a lot of politics, economics, linguistics, gender studies as a base, and then you could focus in on different pieces. So that's when I really started to do all of my community public health courses as well. And the people were incredible. The professors were incredible. It was a very cool path that I did not expect to find.
Yeah, that's amazing. And I feel like many times we're going into university having no clue what to do, and then there's just so many different options and variety of things that you are able to do. But at the end of the day, I'm glad that you were able to find out about like public health and more get into more of like this activist lens. And I'll talk about that in a little bit. But like, when did you learn about the term like public health? Because is it because you had like you were in a global studies, global health type programs where they were public health classes, or like what how did that work out for you?
Yeah, it was 100% through the academics. So it was through my first public health course, which I believe was called community health at U of I, not public health. And that's when I learned about it. I had zero clue going into it.
Love it, and I think that is very similar to many of us on our public health journey. Is like not really knowing about it until it just pops up, and it's like, oh, this thing is cool. Like I can
Uh-huh.
actually work in this field and do work in this field. This is a field that you could work in. So yeah, yeah, I'm glad that you were able to get that exposure, and then talking more to like that activism side of you, and like getting activated as an activist. Do you know, talk about how that came about, or like what kind of inspired that move?
Absolutely. So it was part of my upbringing. So we were, I grew up in a very active, politically active, socially active community, and both in my family and in my community. So I grew up in Skokie, which is this little suburb outside of Chicago, and second, it was the second highest place globally for Holocaust survivors in the world. And so this community that I grew up in were people that had survived man-made hell and had seen their entire families not survive this man-made hell. And I don't want to generalize every responsible Holocaust survivors or trauma survivors, but the response in my community was to do everything in order to make sure that something like this didn't happen again in our lifetime. And it was this root within our community, and it was a huge part of my life and my childhood and my adolescence, just growing up, going to volunteer rallies. My grandma started and ran a soup kitchen for Chicago locals that we went to help out on during the weekends. So it was this huge part of what I knew and how I connected with the world growing up. And that's, I think, why when I found it at my university, when I found that, it was a moment of like, oh, okay, I can stay here, I can do this, I can find my place. It was very familiar to me and very exciting at the same time, doing it on my own as, an adult outside of that community for the first time.
That makes a lot of sense. Being around people who have gone through such a traumatic and like really heart-wrenching period in history of life, and just being in proximity to them, and then seeing that they were actively working to ensure that those kind of things wouldn't happen. I could imagine that can give you the bug to say, okay, I have a part to play in this as well. As those generations get a little bit older, like I'm the younger generation that also has this part to play to ensure that my community is safe. And I think that's important. And
Yeah.
thank you for sharing that. And I didn't know, is it Stokely you said?
Skokie, Skokie.
That's an interesting name.
Yeah,
Skokie.
yeah, it is an interesting name. And yeah, and I actually didn't always know that either. And I remember learning about it when I was a little bit older, and it was actually because of that, because there were so many Holocaust survivors, that in the 70s there was this huge neo-Nazi march in the U.S., and they decided to march through the streets of Skokie because it was where the most refugees from the Holocaust had relocated. And it was this whole Supreme Court case, and it was I don't think that they actually did march in the end, but it really, from everything I read about it, it just woke up the community in a way that it hadn't before.
And that makes sense, because I could imagine like a lot of people, and this is about like a huge assumption here, and sorry if this is a bad assumption, but like going through those events, you might want to just like reject society and kind of like pull away from society, but then seeing that there are these people that are actively trying to continue this horrible type of work is putting it in place to say, I can't just sit here idly and do nothing. I actually have to actively work to ensure that these kind of things don't happen. So
Yeah,
I'm learning some
you're
history today.
absolutely right. You're absolutely right. And I know this is not on the topic of public health, but Esther Perel, the psychotherapist, is the daughter of Holocaust survivors, and she looks at it as well from both of those sides. She says some people run away, some survivors ran away and shut themselves off and said, "How can I ever feel joy ever again?" And some people go the opposite way and say, "Because I survived, because I lived through it, it's my duty to feel joy. It's my duty to make the world a better place." And so people do have such different reactions to things like that, as with all trauma.
Right, right. And like I'm learning a lot just in these first 20 minutes. So I appreciate you. Okay, now going back to your bachelor's, you said you're an activist, and I'm guessing this also like rolls into a lot of the roles that we're going to talk about now. So during your bachelor's program, and I'll list out the roles, and then you can talk about them how you want, because I feel like there's like synergy in the roles in themselves. So one of the roles was an advocacy and public policy intern at the Jewish Council on Urban Affairs. You also had a role as a sexual assault first responder, educator, and advocate at a rape advocacy counseling and educational services. You were a community health organizer and educator at the Greater Community AIDS Project. And lastly, you were a community health educator at the University of Illinois. at Urbana, Champaign. And if you need me to repeat any of those while you're going through the narrative, feel free to ask me. But yeah, we like talk about those experiences and like how you came about into them and like what you did or what you took away from them.
Yes. So, I'm so glad actually that you just listed it out like that because they were very overlapped. So I did a lot of them at the same time. So it wasn't this chronological. I mean, in some ways it was, but for the most part, it was a lot of overlapped pieces that came together for me. And I'm trying to think for a second where to start. So, you know, if I focus for a second on the community education and the sexual assault response that I did, that was a very formative experience for me in public health. It probably was the formative piece for me with public health. It's what pushed me in the direction to say, okay, this is what I want to do in my life. I want to be a community educator, which is what I thought at the time, in the second half of my bachelor's. And I started off with a few friends. We decided we wanted to get trained in rape response, sexual assault response. And, this was before the Me Too movement and before a lot of this was talked about in the same way that it is today. And when I was on campus, I believe the statistics were 1 in 4 women, 1 in 10 men experienced some sort of sexual assault while in college years. And when I was trained in this response work, it was incredibly interesting to learn all of the response work and the thinking and the theories and the resources that go into responding to crisis. So we learned how to aid women and men who show up in the emergency room from sexual assault. So what happened at the local hospital when I was there, the phone call would go to the police and the phone call would go to the rape crisis center. And one of each would show up and we would really be able to be there and help people go through this terrible experience. And we also worked hotlines. We also, I helped out in very, very, very behind the scenes at the time, but in court cases that were happening at the time that the crisis center was supporting. And that's also what lit me a little bit in the direction of policy work, if maybe policy was the direction that I wanted to go in. And it was an incredibly powerful experience for me. And what I got the opportunity to do through this response work was also work with a center to go one step back and say, okay, can we educate the community? Can we put different ideas in place to prevent sexual assault, to prevent rape, to prevent sexual violence, violence against women, partner violence, everything like that. And it was the first time I was introduced to this concept of community education and community health education. And it might not be what a lot of people think of as public health necessarily, these types of community education efforts, but it is. It's like what we talked about with quality of life. The baseline of quality of life is safety. And that's not something that everyone feels all the time because of all of these numbers that I was mentioning earlier. So the community education piece was incredibly exciting for me. I worked with this wonderful woman who was full-time at the crisis center, who we would go into classrooms. We would go into these environments where no one wanted to talk about, consent and healthy communication around consent. And you walk into these classrooms and it's like the last thing you want to talk about with your teacher standing in the back of the room.
Right.
And this woman just did such a good job. She mixed in humor. She made people laugh. She brought people together. She didn't come in and lecture people, don't rape. No means no, which are obviously the most basic concepts of what we needed to present to these people and to have discussions around. But she did it in such an approachable way that till this day, I look back in awe with how she was able to lead those sessions. And so that was with the Crisis Center. And then in parallel, I did something very similar through the university, which was similar workshops with students around consent and communication and boundaries, which was challenging and really, really important. And again, goes back to that idea of these crises are happening all around us, and we need systems in place to support them when they happen. And at the same time, we also need to backtrack and see, okay, what can we do on a base level? How can we change people's concepts in their mind around consent, sexual safety, expectations, communication, and try to empower people to have healthier relationships moving forward. And that was a very powerful period for me.
I find it interesting, like the perspective of you sharing, like this wasn't when you're saying like during the Me Too movement and like they weren't these pushes for like having this communication and like just how important that is to safety and to not having like this kind of like rape culture out there. And
Right.
like to your point, like this is a part of public health because we need awareness first and foremost before anything, because if people aren't aware, they aren't educated about a topic, then they're not going to know like this is wrong or this is how I should approach it. And I would even say in my life, especially like that communication around consent and stuff like that, something that like you actively have to learn. And it's like, and it's
Right.
especially in systems, school systems like the US school systems that do not teach us enough about consent and sexual health or sexuality education. As I was talking to someone and they wanted to say sexuality education over sexual education, which you listen to that episode, but it makes
I
sense
like
because
that.
me too, because what she was saying is that like sexual education kind of focuses too much on STDs, but sexuality education talks about like this communication and this relationship, and it's just broader than just like those STDs and like this is what you need to do to prevent disease and these kinds of stuff. It talks about sex in a holistic kind of perspective, which I think is awesome and should be taught
Oh, that
everywhere.
is
But
awesome. That
right,
is
right.
awesome. And it also opens the door to not just heterosexual sex, so not just STIs, wear a condom, those conversations, but also deeper, bigger conversations in general about sexuality and communication and culture, like you said. I really like that. I'll have to listen to that episode.
Yeah, yeah, absolutely. And if I'm not just sure if it'll come up before or after this, but if it comes up before, I will link it in the show notes so people can check that out pretty easily as well. Yeah, but I appreciate you sharing that. And it is definitely a skill for someone to go in into like a community health education setting and not lecture at people, but make it engaging and make them interested in the content as well as get takeaways from it. So yeah, shout out to that health educator as well as all the other phenomenal health educators out there that are able to bridge those gaps and not just lecture at people, but like make it engaging and make it involve the communities that they are talking to.
Yes.
Awesome. And I
Amen.
don't I don't know if you spoke to your role as an advocacy and public policy intern at the Jewish Council on Urban Affairs, but I'd love to hear more about that experience.
Yeah, so that came a little bit earlier. So I'm trying that might have been even a smidge before I understood what direction I wanted to take with global health and public health. And this is a really cool organization in Chicago that started in the 60s by this Rabbi Marx was his name. And he started it as this Jewish community activist organization in Chicago during the civil rights movement, marched with Martin Luther King when he was in Chicago, and really rallied the Jewish community with a lot of those values that I was speaking about earlier in order to make an impact in the Chicago community. And it's still a very active organization today. And they are incredibly diverse and broad with their goals and what they're doing. Or I'm sure actually their goals are very narrow and specific, but they're achieving those goals through so many different ways. And I worked there for a summer when I was home from college, and it was such a cool experience. I worked for this guy, Tom Walsh, who I believe his title was the director of public policy. And every morning we would come into the office and we would just get in his car and drive to another community center, another political hearing, another, rally, another something, and organize. We were helping organize the Chicago community around public housing. We worked with DACA students to work on the different immigration reforms that were very much debated at the time. We looked at we worked on so many different things that summer, really with a focus on those two. And it was really one of the coolest experiences I had, just to be on the ground is what it felt like. It was to really be a political organizer and a community organizer. And again, it all kind of goes back to that whole idea of how do you use your voice, and learning from my perspective, I knew what interested me, but I wasn't sure how I fit into it in the right way. And just getting that opportunity to be in the room with such amazing people. And there were so many religious groups. So we were very involved with the different churches that were organizing for these different purposes, and student groups and youth groups and things like that. And just really incredible people in the community that I got to meet and be a part of for a summer. I'm really
That's
grateful
me.
for that experience.
It sounds like a great experience, and I feel like anytime you're a bachelor's student, you're able to get in the car with someone and go to communities. A lot of the
Yeah.
times, that is going to be like a pivotal experience, and you get to just observe and learn and see like what this work on the ground actually looks like. And I think like that community organizing is something that kind of like gets left out of the public health narrative too much, but it's like so important, because it's like, how do we get people to coalesce on these issues that are affecting them and like advocate for that change? And that's like at the heart of what we need in public health a lot of the times.
And it taught me so many interesting lessons around partnering and partnerships, because each group was distinct. Each group had their own mission, their own group of people, their own purpose, but they were able to build these coalitions within the city. And that became so powerful, which was really just amazing.
Were there any undergrad takeaways that you had, like being in this program, learning about global health, public health, as well as like being in these community organizing, community health, education type roles?
I'm not sure if this was something I realized at the time, but looking back on the experience that I had during undergrad and everything that was available to me, everything that was at my fingertips, just being on this campus environment and in this academic environment, I never got that again, and I miss it so much today. Just being able to, and my partner always makes fun of me like I was such a nerd, because I would just go to these lectures at night and these events and these activities, and it was so rich, this feeling of knowledge and knowledge sharing and activity, and I loved it. And I didn't know when I left that that's not something that you just have access to all the time as an adult living in the city. It's like I can't just find these lectures and find these events as easily as when it's through your department or through a friend's putting it on or something like that. You really have to seek it out in a different way. And I'm so grateful, and I really wish that, and I know there are places that have that, but it was such a cool environment to be in, and not something that you have for the rest of your life.
Yeah. Firstly, nerds make the world go around. So shout out to all the nerds out there. We need
Yes.
we need the nerds. you can make fun of them now, but they're going to be the ones in positions of power. So just remember that.
And he's a nerd too. He just doesn't like to admit
it. Right. That's another thing about nerds. They don't like to admit it.
Exactly.
And then part two of that, I think that's so important to realize, because when you are in these collegiate environments, it literally is like this incubator for people, and you're in a space with a lot of like-minded people that gives you opportunities to go to those lectures and to just learn from people and hear different ideas. And yeah, it's very real. As you graduate, it's not as easy or as simple to be connected into those kind of opportunities. So yeah, that does make a lot of sense, and I'm glad that you're highlighting that. So people that are in school right now, like really soak it all up, enjoy it, and see how you can best take those experiences and apply it to whatever you're going to be doing afterwards.
And incubator is the perfect word for it.
Well, I'm glad I used the word then. Okay. So you got your Master's of Public Health at the Hebrew University of Jerusalem. Before I ask you about like your thought process there, I wanted to ask, was this your first time going to Jerusalem? And I know that there's the Back from Birthright program that Israel has, where people are able to come to Israel. So were you able to go to Israel prior to this? And like, if not, what was your thought process and like making this decision?
It's such a good question, right? Like how the heck did I get there? So my dad is from Israel. And so he, we lived in Chicago growing up, but we came back almost every summer to spend our summers here. Every summer, every other summer. And here, I mean, Israel, because that's where I am now. And so I grew up back and forth. The US was my base. It was my home. It's where I went to school. But a huge part of my identity was my dad's heritage and that whole family on my dad's side. And so I did spend a lot of time here growing up. And then the first structured thing that I did here was actually I studied abroad during my undergrad here in Israel at the Hebrew University, actually.
Okay.
And during that time, I did a very cool independent study with a woman from the social work department on refugee health here in Israel. So at the time, and still today, there was a big influx of refugees coming in from Africa who are crossing over the Sinai and coming into Israel. And a big question, like it is all over the world, is how do we support refugees when they come into these communities? What's the right way? What's the best way? And it's, of course, a very heated topic. And so I did a lot of work learning about what they do here in Israel. And I loved it. So that was also a very cool undergrad public health in the community experience that I got to have that was already here in Israel. And that's what kind of opened up the door for me to actually stay and continue my public health career here versus the US.
Yeah, that makes sense. And just being able to get exposed to that, having been part of the university system in some respects before and doing that public health work, I think is really cool. And one thing that I always remember someone from Israel telling me is that it's so weird when he came to the US that people have to register to vote, because in Israel you're like just naturally registered to vote as you're born, which I thought was a huge like dynamic shift for me, because I never even thought of that as like just that being a natural barrier to people being a part of the political process, but it is inherently a barrier here that is not the case across there. And that's interesting tangent.
You're right.
Yeah.
And I actually never even thought about that I never registered to vote here, and yet I vote. We've had a million elections in the last couple of years, so and I never even actually thought of that I didn't have to register. In the US, it's such a barrier, like you said.
Yeah. And that's just my tangential brain going all over the place.
Well, see, now I learned something too, actually. So this was great.
Well, I love to hear that. So you got your Master's of Public Health at the Hebrew University of Jerusalem. So what was the thought process? How did you know that you wanted to study and get your Master's in public health?
That's a great question. And it's something that was relatively an easy decision for me, but I did, of course, have a thought process going into it. At the end of my undergrad, I knew I wanted a career in public health, but I wasn't sure how to get there. I didn't know if I wanted to go the route of public policy. I consulted with a few people about going to law school, if that was the route I wanted to take. Not bashing lawyers or law school, but unequivocally, the answer was do not become a lawyer if you only want to work in public policy, because it is such a long process. And shout out to all the lawyers who have gone through that process. But, if you want to work in policy, there are so many other ways that you can get there. And I'm sure it doesn't hurt to be a lawyer, but that was the advice that was given to me at the time. And so I decided, okay, I'm not going to go to law school because I don't want to be a practicing lawyer. I'm more interested in policy. That was one of the directions I was considering going in at the time. And then I also, thought about a few other directions. And I know I've heard a few people on your show talk about the same thing of, well, do I want to be a clinician? Do I want to work with people? Do I want to go into human care? And that was also something I considered, but very briefly, because I knew it wasn't for me. I knew there's nothing more important than those people, but that it wasn't the direction that was right for me and my skill set and where I enjoyed working the most. And then I kind of discovered this master's in public health. And it's also, going back to what is public health and what do people know about it. It's not something I was familiar with. I didn't really know that it existed. I didn't know what it would allow me to do, what it was really. And I kind of just went for it, It was very clear to me, like, well, I want to learn this. I want to work in it, and I'm going to do it.
Love it. Love it. Take the deep dive. I'm glad that the deep dive was into public health, because we love public health in this podcast, as everyone knows. so shout out to that. And did you have any concentration, or was it just like a general public health degree? Talk more about that.
Yeah, so my concentration was in health promotion and behavior change. But in parallel to that, I was a research assistant in epidemiology at the same time, and I wrote my thesis in epidemiology, or it was an epidemiological thesis. And so my official focus was health promotion, and at the same time, I loved epidemiology. And what I always would think about and tell myself is, I want to work in health promotion. I'm much more interested in that than having a career in academia and epidemiology and biostatistics. But I loved learning about epidemiology. And, I mentioned in the beginning, I had such an aversion to math growing up. I thought I wasn't good at it. I didn't like it. It made me insecure. And suddenly realizing, well, I'm actually quite good at it, and it's incredibly interesting. And just diving into that data was something that was so exhilarating for me to learn how to do. And so I got kind of the best of the both worlds. I chose the health promotion track and I loved it, but I got to work with such incredible people in the epidemiology department that taught me so much. And like I said, I still use those data storytelling skills today, which is really cool.
It definitely is cool. And I just want to highlight the point that, you can choose one concentration, but that doesn't mean that everything that you do in the program has to be specifically related to that. And especially in public health, there's so much opportunity for you to dive into other intersections of public health or other like focus areas of public health, and be able to build out like a broader skill set that will be like more helpful in the long run.
Right. And today, by the way, I don't know how it is in all programs, but I had the option of health promotion, epidemiology, or healthcare administration, or like economics, I think they called it in my program. And my work today is 100% all three. If anything, it's the one that I didn't focus on. if anything, it's more of the administration side, but it's such a jumble. It's such a mishmash. You can't look at public health and say, we're going to look at healthcare administration and not take health promotion into account or not take epidemiology into account. You just can't do that. And so, the focuses are important from an academic perspective, but more important is understanding that there's a full picture behind it.
I love that, and I'm glad that you said that, and I think that's helpful for people to hear, because a lot of times people are so hung up on like choosing a specific concentration. I was
Right.
like, is this what I'm gonna do? It's like, yes, but it doesn't really matter at the end of the day, because it's like just building skill sets. And to your point, there's so much that goes into public health, and it's not just one or the other. It's one and it just keeps on adding.
Yep.
So yeah, I appreciate you sharing those insights.
Thank you.
What was I going to ask? Also, during this time, you started working at MyndYou, but as a senior customer success, operations, and business development person. And I believe you were in this position for 3 years. And this began during your Master's of Public Health, correct?
Yes. So I'm a big fan of mixing a lot of things together. So as I was studying for my master's in public health, I was working full time, and I was sewing together, a bunch of these different side gigs and trying to just find anything and everything that I could. So I was tutoring English. I was working in an administrative role at a doctor's office. I was really just, I was a student. I was finding what I could find. And about halfway through my first year in my master's, I was introduced through a friend to the CEO of this digital health company where I work today. And this CEO, who's one of the most incredible people I know, was looking for, she had just started the company, and she was doing it all on her own at this point, as many entrepreneurs do in the early years. And she was looking for someone to just come on board and start making a brand, posting on social media, talking about her company on Facebook. So this is even before the role that you were talking about. This is one step earlier, just how I even got my foot in the door. And technology startups was the furthest thing in my mind. Remember, I was like, I'm going to be a community educator. I'm going to work in policy. I'm going to, go work in the Ministry of Health. So I didn't even think of this as a potential for me as a career in any way, shape, or form. But I said, you know what? It has the word health in it. It's a healthcare company. So yes, sign me up. I need things on my resume. That's not tutoring English and, the other things that I was doing. And I met Ruth, the CEO, and we just clicked from day one. I fell in love with the mission of the company. It became so much more than this tiny little side gig that I thought it would be at the start. And it grew very quickly from, let me post on social media for you for an hour a week, which, by the way, I'm not good at. And it was just, it wasn't the role for me. And it grew really quickly into, come on, let's do something together. Come on board. Let's make this a real partnership. Let's build this company. And I feel so lucky that I found her and that I found this company and that they took a chance on me as someone who had no experience in technology, really didn't have that business experience, and just built, as we built this company, it was the vision of the two co-founders who just brought this vision to life, saying, hey, I think we can use technology to broaden access to care, to help people who don't have access to their doctors when they need them. And I got on board and started out as a generalist, so operations, business development, customer, initial customer management, things like that, and grew very quickly from there. And it's been a really exciting ride.
I could imagine. And just for context for people, I think you've been there for 6 years, almost 7 years.
Yeah. Yeah,
Yeah.
yeah,
And
six, almost
and you
7 years,
shift
which is
and you shifted
crazy.
from like this it's crazy. And you shifted from like the social media role to the senior customer success role to a director role to a VP role, which you're currently in. And we'll get to that. But I think, like, to your point of just getting your foot in the door, how do I get experiences? Like, oh, it's healthcare, let me do something with this so I can just build my resume, build my experiences, and like build onto those skill sets. And to that point, like, you never know what will come of it, as these, like, 6 years, 7 years later, and you're the VP of customer success at this organization that you just helped support with the social media. And I can imagine just being a part of that growth of the organization is such a fundamental learning for you, and probably even like this digital health aspect of things, because I'm not too sure how much you learned about digital health in your public health, massive public health courses, but just learning all about that is in itself like great experiences and great ways that you're able to leverage like that public health degree to work at that intersection of public health and digital health, which I think is awesome.
Yeah, absolutely. So first of all, yes, it's been crazy to go from, yeah, that little social media, very part-time social media coordinator to, VP running a team. And it's been and again, I'm so lucky that I got this experience and that I've been given all of this trust, and that I've been able to help deliver what I truly in my core believe is going to change so many lives. And to your point, it was not at all talked about in my master's in public health program. And, I started working here in my first year. And so I remember asking professors, like, what is all this buzz happening around technology and digital health? And, how could this help people? And there was so much hesitation. And there still is so much hesitation in academia to introduce things that are not clinically proven. And so unless you can go through a 5-year clinical trial, then, we don't teach about it, we don't talk about it. It's not evidence-based. And as someone who comes from that public health world, I believe in the importance of evidence-based. I believe that science is the way that, the path that we should follow, and that there's so much value in clinical trials and really robust and rigorous research. At the same time, these startups and these ideas and these innovations are life changing. And I'm not talking about like, oh, let's inject people with a drug that we never heard of, but these little digital tools that are not with any risk, but can make such a difference. It was not something that was talked about in my program. And it's, maybe it is a little bit more today. I'm not sure, but
I don't think so.
yeah, I don't think so either. And it should be, because we're in a digital age. And I used to have conversations. I know you had another guest on who was talking about how she's a futurist, and she talks about being a futurist as someone who envisions their future and looks forward. And in the technology world, being a futurist is someone who looks at AI and VR and how can that impact the world. And I'm not a futurist. I am super freaked out by technology. I've always been super freaked out by technology, and I work in technology. And I think that combination of someone who says, wait, but humans first, we have to have humans here, we have to put people front and center. How can technology help them do that? Is exactly the story that we all need to be focusing on right now in public health. You cannot separate between public health and technology. You cannot. I truly believe that.
I absolutely agree with that, and I think like there are many like threads that are important here. I think that the first one is like just having exposure or access to know that like the digital health world is something that you can apply your public health skills to, is something that's only now starting to be spoken about more. But I still don't think from the masses of public health programs that they are giving people enough information to know that like these are spaces that you can you can come to, and like to your point, like bring that human-centered approach and really ensure that we're thinking about the populations that we serve and how does this technology best serve and interface with them, is very, very important. On the other side of things, it's like how I can't remember the other thing I was going to talk about. I should
I
have
went
written
on
it
such
down.
a tangent.
No, you're fine. You're fine, because all great information. Okay, so taking us back. So before we get more into what you did as a senior customer success operations and business development person, can you just kind of explain what MyndYou is?
MyndYou is a digital health company, and we have a platform. The name of our platform is My Eleanor, named after the first occupational therapist. And My Eleanor engages with patients in between their visits with their doctors and with their care providers and with their healthcare teams. So, how does Eleanor do this? We're in the digital age, right? And so everything is on your phone. It's the apps, it's the portals, it's all of these. To you and I might be really basic. To a lot of people are incredibly complex.
Mm-hmm.
So what we've done is we've put a lot of the complexity in the background, and all the patient has to do is talk on the phone. Mm-hmm. And so Eleanor, who's again named after the first occupational therapist because that's the values of our company, Eleanor talks on the phone with patients about their healthcare needs, helping them navigate the healthcare system, get in touch with their doctor when they need, talk about their chronic conditions, talk about behavioral health, help set them appointments, help guide them along their care journeys when there just simply are not enough people in the workforce to be able to do this for them. So we work with people across all different populations, but our sweet spot is really with older adults who cannot navigate the portals, won't download the app, don't have the Fitbits and the Apple Watches to help them know when and where and what they need to do and when to take their medication. So Eleanor is kind of like this care assistant that helps people along their care journey, but it's all done over the phone. And we actually partner with the hospitals and the health system. So we're not direct to consumer. We don't work with the patients we don't sell to the patients directly. We work with the provider because, again, it all comes down to that human connection. So we're not just trying to work with the patient. We're trying to loop the patient back in with their provider, with their nurse, with their care coordinator at the right time. And so those are the people that we get to work with. We work with the clinicians and we work with the patients, and we bring them together through digital means.
That makes a lot of sense. And to your point, like just being part of that ecosystem, not trying to create your own thing, but working within that ecosystem to bring the solutions to the people that need it the most in the simplest way that they can access this and use this information. So that is awesome. And so what do you do as a senior customer? Oh, before that, I remember what I was going to say earlier. I think you were talking about the point of like just public health programs wanting to focus on just evidence-based programs or things that have been tested for like 5 years and things like that. And I think in today's world, we need to be able to say, what are these innovative ideas that we can do to really accelerate this? And like, it doesn't have to be evidence-based, but what are the results that we're seeing from this pilot project, and is it actually getting the outcomes and getting to the things that we need to get to? Because I think within that whole evidence-based, like, yes, it's important, I'll say that to caveat everything, but I think at the same time it prevents us from really accelerating ways that we can help and support communities that need help and support right now. It's like people don't want to wait 5 years to learn how to better approach and get into care management or whatever the case might be. So it's like, what are the things we can do now that aren't going to hurt the patients or the customers or the clients, however we want to think of them, but are going to support them in having their best health and having a way that they can equitably access and communicate with the health system so that they can drive forward and like just have their best lives, like as we were saying earlier, like living till 100 like you're 20. Like we need to give them access to these types of tools so that they're able to live till they're 100 like they're 20.
You're absolutely right. And the way, the way that we look at it too, and the way that I personally look at it is, what is the data that we do have? And what does the data show? What are those stories that we're seeing both from the human side and from the data side to make me sit back and say, okay, this actually works, or, okay, this might work better if we do something different. Let's do some A/B testing. So everything we do is rooted in data. We're very lucky we have a team of data scientists that work behind the scenes on the product, but then as well can help us analyze patient data, community data to see what's working, where is it working, what can we do better, and how can we improve.
Can you talk more about that role after your social media stint as a part-time person supporting the world? You were hired into senior customer success operations and business development role. So what did that entail?
So that was really a generalist role. And so it was so cool because we were such a small team at the time. I joined, there were the two co-founders, CEO and CTO, Chief Technology Officer, who's the data scientist, and a clinician, an occupational therapist. As I said, the identity and the value of our company is rooted in occupational therapy, because occupational therapy looks at whole person, holistic health. So for example, if someone went to the hospital, was it because of their heart, or was it because of the way that their house was structured, or the way that the transportation that they needed to get from point A to point B, or their work, or their, what's the full person health, and that those whole concepts are really rooted in occupational therapy. And so this was our team at the time. We were this tiny little team of 4 here in Tel Aviv, just with these wild, exciting dreams. And I started out really just kind of, as we all do in those early days, a little bit of everything. On the operations side, working on everything from payroll to legal documents to where our office was, for example. So those ins and outs of just how does a business work? What are these little things that we need to put together from a logistical perspective to make this company run? And then business development, customer management, what's our product market fit? So these really early days of understanding, here's the technology, here are the ideas that we have. Does it fit within the market? Is there something that can actually, is there a need that fits our capabilities and our roadmap and our vision? And iterating and honing in on, how can we make this more specific? How can we make this more actionable? It was the whiteboard days, where you just have the whiteboard and you're drawing and you're crossing out and you're taking pictures of the whiteboard as if you're ever going to be able to read it, years later when you try to, zoom in on your phone on this picture. But it was the whiteboard days. So that was really what that role entailed. It was working with our first customers, leading these pilot programs, trying to get really, really initial proofs of concept, and then iterating, being open to changing and growing and adjusting to the market always, again and again and again, which, by the way, we always have to do. Sometimes it's more intense, sometimes it's less intense, but being able to understand the market that you're in and the workflows of the market that you're in is so important for digital health, because there's so much change management happening around technology. So that was that first role. It was really just very horizontal within the company. And then what I got to do is move more vertical into customer success.
Yeah, please share more about those transitions. And yeah, I'll ask more questions when you get into your director role and then your current role as VP.
Yeah, and it wasn't very stark. It was kind of this flow into more of a leadership role. But first was really understanding, well, where do you want to focus? Right now I was doing operations, business development / sales, and then customer success. So customer success is post-sale, managing that post-sale journey with the customer. So having them implement your product, adopt it, grow with it, and really see what happens live, once you hit the play button. And kind of similar to my public health journey, I wasn't sure where I wanted to focus. I really loved everything that I was doing. I was having the time of my life in these early days at this company, but I loved working with the customers, because I think that's what really woke up the public health side of me, with understanding how these companies are delivering care to their patients and how we can fit in to that those care delivery models. And, pre-sale, you stay on the surface a little bit more. And then as soon as that sale happens, we went in so deep with our customers to understand, well, how do they deliver care today? What are the different trigger points that tell them to start engaging with a patient? What are their goals? How, what do they want to prevent? Do they want to prevent hospitalizations? Do they want to prevent falls? Do they want to prevent chronic condition exacerbation? So really understanding what the goals of our customers were and how our product could fit in to then help them achieve their goals and those long-term relationships. So most of my customers I've been working with since day one, they're still here, and it's watching these relationships develop and these companies develop around this thing that we've created. And so that's when I decided to just, that's where I want to go. I want to go deep into customer success. I want to manage these customer relationships long term and understand how healthcare works on the ground.
A point that I did want to make is like just the iteration and just like the focus of iteration is, especially in digital health companies, you can see that, like, because the landscape changes so quickly in a lot of circumstances, it's like, how do we stay up to date to give the best that we can, whether this is a platform or whatever the case might be? Like, what are the things that we need to do to adjust to meet the customer and or the consumer wherever they are at? And I think that's one thing that, like, traditional public health kind of struggles with, or like that iteration process takes a long time. And maybe even like when they do iterate, it's like, oh, it's ready time to iterate again. It's like we need to change again because yeah. So I think that is something that hopefully can transition into like the more traditional public health realm of things. Just that speed of iteration and applying what you're learning and iterating on that. So I appreciate you sharing that a little bit earlier. And what has been, because you said like right now you are managing people. What does that like look like for you in your career development? How'd you become a successful manager?
I love that question. And I hope that I am a successful manager. It's one of my favorite things. It really is one of my favorite things about what I do. And one of the things that I love about it is having these conversations with people on my team about their careers and how they got here and where do they want to go. And I have an amazing public health guy on my team who is just, every time we talk about public health, we just can't stop. It's one of, so
Right.
Kind of like talking about those career journeys and how MyndYou fits into that and how they fit into MyndYou, and just that whole idea of just as a manager, understanding my role within their careers has been something that I didn't necessarily expect, but something that I personally really enjoy and try to focus on. The other really cool part about the team that I have, so it's a diverse team. It's a really great team. We have traditional customer success managers, we have clinical operations specialists, support specialists. So all of that sits under the customer success umbrella that I lead. And it's a really talented group of people that worked in emergency rooms, people that worked in primary care offices, people that came from all, with multiple degrees, with no degrees. So it's a really great team. And above all, the commitment that we have to the mission is one of the most beautiful things I've ever seen. So we have this this channel on Slack where it's Humans of New York.
Mm-hmm.
So we call this Humans of MyndYou. And again, it goes back to being human centered. And that's where we tell stories that we come across in our work: patient impact, clinician impact, user impact, different stories that take place. Patients that told Eleanor that they were too scared to go back to the hospital, and that same day got someone to come to their house or got a prescription for outpatient tests and didn't have to go back to the hospital. So those stories are what, keep pushing us forward every single day. And without those stories, we wouldn't. It's all about the stories. So the data stories and the human stories. And I'm lucky enough to have such an amazing team, both that I manage, and then of course on the other teams as well, that is just so committed to the mission.
I can tell that you're a successful manager just by how you speak on it, like trying to figure out how someone fits into how this role fits into their life plan, as well as like how that fits into the MyndYou plan. And I think that is something that isn't easy for a lot of managers to kind of swallow, to say like, this is just a part of your journey, or it might be like a longer part of your journey, but like how can I support you in this process, or like in this time point right now in your life to grow, to help you to get to where you need to get to, or where you want to get to. Yeah, so shout out to you.
Thank you.
You're welcome.
I appreciate that.
Of course. And then in your role as VP of customer success, what types of things do you do?
So in my role today, I get to lead this amazing team as they work with our customers to help them reach their goals. And so our role as the customer success team is to get our customers adopted onto MyEleanor. So help them understand how Eleanor is going to fit into their workflows, help them engage with their patients at the right time, and really first and foremost, understanding for them what their goals are. And so this could sound super obvious, but a lot of the times when people, when organizations start working with vendors, they're like, okay, let's start. We want to go. We want to use it. And something that we do with our customers, which is really important, is we take a step back and we say, okay, first I'm going to do a 5 whys activity. The 5 whys activity is, tell me why you want to use Eleanor. I want to use Eleanor because my staff is so overburdened, and I want to take tasks off of them. Why do you want to take tasks off of them? Because they are way too qualified and they're better spent doing clinical work with patients. Why do you want them to do clinical work with patients? Because our goal is to keep them out of the hospital, and we need to keep our patients out of the hospital. There you go. That's our goal. We're here to keep patients out of the hospital. And that goal setting in the first phase of when we work with customers sets the conversation for the next years to come.
All right.
All coming back to that idea of what does success mean and why are we doing this together. And so back to what I do as the VP of customer success is I set those plans in place. So what I've done, again, remember, like this didn't exist when I came to MyndYou. And so it was really to come in and say, what's our customer journey? How do we take our customers from point A all the way down to they love it, they're growing, it's spread throughout their entire organization. We have people telling us that they can't live without Eleanor, that they have started referring Eleanor to their colleagues in the field, and growing from there. So how do we take our customers from point A to point Z with Eleanor? And that's the role of our customer success team. And that's my role as the VP of customer success, was to build out those processes and those expectations and those milestones with the team. Another piece of my role as the VP of customer success is to work with a lot of the executives of our customers. So the CEOs of health systems, CEOs, VPs of care management, clinical directors, and people in those roles, to really understand, again, what are their goals with Eleanor and how can we make the biggest impact possible today, tomorrow, next year. And having those conversations with these healthcare leaders around what is going on in their world. So changing policies, changing workforce restraints, strikes, nurses strikes, COVID pandemics, all of these things that are just happening around them at massive rates. And then again, seeing how Eleanor can fit into that. And that's why, and I've spoken about this a lot, customer success, the best place for someone who's interested in public health to be in a digital health company. We have, or, something like product management. But for me, customer success is what gave me a front row seat to say, how is this working within all of these complex healthcare systems that exist around us, and to really get deep with them. And it's really, really interesting to work with those executives in these healthcare companies.
I love that. I love that. So anyone that is interested in public health and the intersection of digital health, look out for those customer success type roles, because
yes,
as Tali said, you will fit right in.
You absolutely will.
Awesome. And I also like the perspective of like the 5 whys. And that was something I learned in a conference years back. But so many times, whether that's in our own personal lives or like business life, we don't ask like, why are we really trying to do this? And like, to your point, when you get that clarity on that from that customer, then you're able to understand like what that journey, or like what the roadmap looks like for this customer, and how you can best support them in getting to their goals and solving that and becoming the solution for that why, or that fifth why, the deepest why that they have. Yeah, which makes a lot of sense.
Exactly.
Awesome. Quick question here. If for someone that is interested in like digital health and the intersection of public health, outside of looking at those customer success rules, what types of advice would you give them?
So first and foremost, and this is advice I would give to anyone pursuing a career in public health, would be to become well-versed and knowledgeable about that intersection. So how is technology playing a role in healthcare today? It's here to stay. AI in healthcare is here to stay. Understanding what that looks like, where it is today, where people think it's going to be tomorrow, and being a part of that conversation is, not only is that going to differentiate you in the market. So for you to come and say, I'm an expert in public health and I know what's going on in digital health is really a huge foot in the door. And it's voices that are needed in the conversation, in my opinion. It as I said, I would not identify myself as a futurist. Technology really scares me. And having people who have these public health voices within those conversations is really important. But again, back to your question about how would someone get their foot in the door, to me, and actually when I hired my most recent customer success manager, I specifically was seeking out people with public health backgrounds, because it really is such a knowledge base that can be a game changer in this field. So for someone to be able to sit and have a conversation with the care coordinator and with the director of population health and with the COO of this company, to have a healthcare background, to have a public health background is so important. And it gives a perspective that I feel is incredibly valuable in the conversation. And it's important to, again, to differentiate between different digital health solutions and health tech solutions. There's AI imaging for radiology, for example. Super cool, super advanced. Not something that is as specific to public health. And then you have different digital health solutions like the one I found, and so many others that are out there that are really filling in that gap of how are people accessing their healthcare? How are people addressing social determinants of health? There's so many public health companies, digital public health companies out there. So I think it's about finding the right company that fits your knowledge and your interest and your expertise, and then saying, hey, I can be the best customer success manager for this company.
Great advice. Okay, so
was it helpful? Did I make sense?
I definitely think so. And
okay.
I guess you're listening. Let me know if Tali makes sense. If she didn't, you can find her on LinkedIn and tell her she didn't make sense. But or you can tell her she made a lot of sense, and connect with her and follow up and find some more information. And because I think that's one thing I would advise you all to do is like reach out to the guests that are on this podcast and see how you can have conversations so that you can get even deeper insights into what they're doing and how you can work similar roles or get your foot in the door, or just like be connected into the work and understand like how does public health work with digital health? Because yeah, it's not something that has been spoken about enough in my perspective, but I think we're having more of these types of conversations now. So
Agreed.
yeah, so before I move you on to the Furious Five, I'd like to ask, where would you like to see yourself in the future?
I love that question. For now, I'm very grateful to be able to say that I see myself in the same field that I'm in now, which is that intersection of digital health and public health. And what interests me most about it is the adoption. And so we have all of these amazing, smart, brilliant entrepreneurs and product visionaries creating these products that can change healthcare. No doubt about it, can change healthcare. And then on the other side, we have these experienced, brilliant, genius clinicians and healthcare operators working on the ground in healthcare. And yet there's this challenge, there's this huge challenge that sits in the middle, which is how do we get these ideas to actually work within the practices of today? And there's a tension there. And I love exploring that tension and breaking that down and trying to find out, okay, what information can I bring back to the product team to say, hey, actually, if we made this little small change, it would make a world of a difference. And then at the same time, coming back to the healthcare teams and saying, hey, can we talk about change management? Can we talk about, changing some processes here that can then, again, make a world of a difference? And so that's really where I see myself in the future, is staying in that intersection between the digital health and the public health, but specifically around finding those tensions and working out how we can bridge the gap between the two. Again, brilliant people on both sides, mission-driven people on both sides, but they have to work together. They have to actually work together in order to be successful. So that's where I see myself.
Love it, love it. And be sure to follow Tali on LinkedIn so you can follow along with what that journey looks like and just see how all of that unfolds. But I appreciate you sharing that.
Thank you.
You're welcome. And moving on to the Furious Five, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health? Granted, you kind of shared a little bit about that a little earlier.
Yeah, so I don't even remember what I shared earlier, so I might repeat myself. But the first piece of advice that I would give, which is really personal to me and my journey as well, is to have a good understanding and a commitment to your mission. Understand your mission and your why, but be open about the how, be open about the path. And so, again, my personal experience was I knew I wanted to make an impact in healthcare. I knew I wanted to help ease people's experience within the healthcare system. I thought that was going to be through community education, through community healthcare, through policy and things like that. And then I was introduced to this completely other direction, but my mission stayed the same. I'm still impacting everything that I wanted to impact, but the path to get there was not even close to being on my radar at the time. And so know what your why is, know what your mission is, but be flexible on the path to get there. So that is just a general piece of advice, probably for all people, in their career, not specific to public health. And then specifically in public health, I mentioned this a bit earlier, but understand what's going on in this digital space, understand the impact that technology is having on healthcare, because it's happening and it's not going to go anywhere. And we need the voices of public health champions within that conversation, and it will differentiate you as well in your career journey.
Love that. Love that. Great advice. And number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
Know the business, know the product, know the data, but focus on the people. Have conversations, understand what the end users are experiencing, what the clinicians are experiencing, what the executives are thinking. Focus on the people at all times. Become the expert in everything you need to become the expert in, but never lose sight of the people. And that includes the people on your own team.
That's some real hard go hitting advice. So I appreciate that. That was good. That was good. Number 3, what's something you are working on improving in your life right now?
Oh my gosh, how do I choose just one? So I've recently recommitted to daily exercise, and it's been incredible. But actually, what I'm working on now that's even harder for me personally is I try to do a 5-minute meditation every day. I do not do it every day, but I've been trying, and that's actually something that's one of my team introduced me to. So thank you for that. And it's something I'm working on.
Love that. I also I used to do meditations every day, and I'm also working on getting that back into my daily habit. So I feel you there, and yeah,
It is hard.
right. But it is great though. It is great once you are able to get it into your schedule. I definitely think there are a lot of benefits in that. So I appreciate you sharing that, and I hope that you're able to get those 5 minutes in daily. Number 4, you're welcome. Number 4, professionally, do you recommend anything?
Yeah, so I just started listening to the Heart of Healthcare podcast with Tali Segev, and it is incredible. It's really great stories from all different perspectives within healthcare, on the ground, digital, policy, and it's been great.
Awesome. Thank you. That's a new podcast that I will have to add to my list and hopefully find some time to listen to. But thank you for sharing. And I would link it in the show notes for anyone that's interested in checking that out as well. And last but not least, where can people connect with you, Tali?
I'm on LinkedIn, Tali Segev, and I would love to connect with people.
Awesome. We'll be sure to connect with Tali Segev on LinkedIn. There will be a link in the description right below that you can tap. So it makes it really easy to connect with her. So be sure to do that. If you want to learn more about digital health and the intersection of public health, feel free to reach out to her. She is happy to answer questions. At least that's what I'm saying. Right? Okay, she is nodding yes. So yes, she is happy to answer questions. But thank you so much, Tali, for coming on and sharing information and insights with us. This was really fun, and I'm glad to have captured your insights. And hopefully, this would help some. Well, it is going to help many people in understanding how they can navigate their public health career and maybe even get into the intersection of digital health and public health. So thank you.
Thank you so much, Amari. And you are helping people, I'm sure of it, because this is a really, really great podcast and this whole initiative that you've taken on.
Thank you. I appreciate that. Makes it that more rewarding. So I appreciate that. So housekeeping items, everyone. Thank you so much for watching or listening to this. Be sure to subscribe if you have not subscribed as yet. Leave a like if you're watching out on YouTube, a 5-star review, and share it with a friend. Those 2 things really help the show to get out to more people and helps people to know how they can navigate their career journeys and get into digital health and public health. So thank you all. Enjoy the rest of your week.